Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a grade 1 stroke grade 2 Keratosis Obturans, and this is their yearly or 18-monthly routine appointment. So they last visited last May, and you can actually see that procedural video. I'm going to put the link in the description, but it's video 1003, I believe. And on that occasion, the patient attended with extreme otalgia, so earache in their right ear. They went to see another specialist who was able to remove wax and dead skin from the left side, but weren't able to remove the Keratosis Obturans from the right ear. And they requested the patient to return in a week after they used some softening drops. But they found, after using the drops, that their symptoms had exacerbated and they were in such discomfort that they contacted myself, and we managed to remove the Keratosis Obturans and actually diagnose them with that condition. So here I'm just using forceps. I initially performed microsuction, and that helped me to lift the plug of dead skin off the floor of the ear canal. And then when I was able to get some purges and grip, I went in with the forceps. So this patient actually wasn't exhibiting any symptoms today. You may have seen at the beginning, there was an opening at the top part of the ear canal, the roof, the superior aspect, which allowed sound to go through. They were just going on holiday soon, and we did agree that they're going to come on a regular basis because we just didn't want them to be where they were last March. So it is May 2022. It's about 18 months, isn't it, I think? So they probably timed it perfectly, because you could see the plug was building up and you got all this dead skin. You're going to be quite amazed by how much skin we peel away here. And the patient actually really enjoyed the sensation of the skin being peeled. They described it as an itch that they weren't able to reach themselves. Obviously, we advised them not to poke in their ears. But you can see this is a grade 1 and 2 Keratosis Obturans. Let me just explain for anyone new to the channel what a Keratosis Obturans is. It's an accumulation of dead skin, so keratin, in the ear. So our ear canals and the outer layer of the eardrum is lined with a layer of skin called the epidermis layer. That's the outer protective layer of skin. And the epidermis layer of skin continuously replaces itself with the old skin dying, and that dead skin should slowly migrate out of the ear by itself, almost like a conveyor belt, at a rate of about 1.5 millimeters to 3 millimeters a month. So it moves sideways, literally off the eardrum. So if we were to get a permanent marker pen and I would make a mark on the eardrum, and the studies, there's been some blot ink studies to demonstrate the migration of dead skin using this technique, and we got the patient back every week or month, we'll be able to see that permanent black marker made on the eardrum slowly move off the eardrum, and it will move off in a radial fashion. So by that I mean, imagine you have a puddle or a pond and you drop a pebble in the center, you'll have that ripple effect. So imagine that ripple effect from the center of the puddle is the dead skin. So it moves sideways radially. So this black ink marker pen that we've blotted onto the eardrum, that will move in a similar fashion, and it will get onto the ear canal and slowly but surely migrate out of the ear. So Keratosis Obturans is when this skin fails to accurately and appropriately migrate. Now, there's several possible reasons for that. Sometimes in Keratosis Obturans, the skin does migrate, but it just migrates in the wrong way. Instead of going sideways out of the ear, it migrates inwards into the center of the ear canal, forming a plug. Patients with anatomically kind of abnormal, should you say, ear canals, so they have really steep peaks or troughs and trenches. Skin, as it's migrating, can get trapped in one of these abnormal widenings or crevices, and it can't escape, so it forms into a plug. You can quite often get self-inflicted Keratosis Obturans. That's when someone pokes in their ears. It causes inflammation, and inflammation then leads on to a high tenor of dead skin, and that dead skin then forms into a plug. Patients with skin conditions, so eczema, psoriasis, again, that added inflammation caused by the eczema or psoriasis leads to a higher turnover of dead skin, and the skin can't migrate out of the ear quick enough. So it's produced quicker than the ear can naturally expel it, so you get a build-up. And a grade 1 keratosis obturans is when this dead skin plug, it's causing some discomfort. So one of the kind of a characteristic of keratosis obturans is pain. So most people with keratosis obturans, in fact, to be diagnosed with keratosis obturans, otalgia is the number one symptom. So grade 1 is when you've got a blockage of dead skin, it's formed into a plug. There may not be any noticeable widening of the ear canal, but they will experience some pain, albeit mild. A grade 2 is when, again, you've got some mild pain, hearing loss, but there is some visible widening of the ear canal. A grade 3 is when you've got moderate pain, and in addition to the widening of the ear canal, you also have granulation tissue forming at the outer third joint. So on the outer third of the ear canal is where the cartilage portion of the ear meets the bony part. We call it the osseo-cartilaginous junction. So you get granulation tissue. Granulation tissue is inflammatory tissue. So it's a buildup of connective tissue. It's kind of bumpy and red and moist, and it has its own blood supply. So quite often when you remove a grade 3 keratosis obturans, you get what we call contact bleeding. As you're removing the plug of dead skin, this granulation tissue ruptures, and so does all the blood vessels. And a grade 4 is a really, really severe form. It's when you develop the widening of the ear canal so significant, you form an automastodectomy. Essentially, the back part of the ear canal merges with the bone behind the ear canal to create one big cavity. So the bone behind the ear is called the mastoid bone. Why do we get widening? So when this plug of dead skin grows, imagine it's like a rubber ball and it's getting bigger and bigger and bigger. So the sheer pressure of that plug can expand the bone, and the bone that encases the ear canal, the temporal bone, is considered to be, I think, the second strongest bone in the body behind the femur. So you can imagine that force that plug of dead skin is applying to be able to physically widen and change the shape of the ear canal. But also, as this plug of dead skin expands and widens, it irritates periosteum. So periosteum is a sheath, almost like a membrane that sits on the bone, and it supplies the blood, all the blood and oxygen, all the nutrients to the bone in order for the bone to sustain itself. But sometimes when you get irritation of the periosteum, you get periosteitis or just a bit of inflammation even, it doesn't have to be infected. It can initiate cells that live on the bone called osteoclasts, which start to basically decompose the bone, really. It causes necrosis of the bone. The bone becomes to die, and you then get remodeling. So as the bone begins to degrade itself, probably a better term, of course you get a widening of the ear canal. And the treatments for keratosis obturans, of course, avoid poking your ears, don't get water in your ears. Sodium bicarbonate drops generally works better with keratosis obturans in my experience than olive oil, and I'm a big fan of olive oil. But sodium bicarbonate helps to break down the skin cells. It doesn't dissolve the keratosis obturans, but it can make it easier to remove because the skin is broken. Olive oil doesn't really break down skin, it softens skin. But sodium bicarbonate drops, it actually absorbs the water in sodium bicarbonate. So when sodium bicarbonate is instilled in the ear, it reacts with an acid, a carboxylic acid, which is excreted by bacteria that feed on sebum. So sebum is a oily lipid secretion found in our ears, secreted by the sebaceous glands, which are also found in our scalp. It's made up of organic compounds like alcohol, squalene, cholesterols, long chains of saturated and unsaturated fatty acids. So bacteria feed off that and they release an acid, a carboxylic acid. Sodium bicarbonate reacts with that acid and it's transformed into water, and also carbon dioxide. So when it's converted into water, the dead skin cells that form the plug of Keratosis obturans absorb the water. So the dead skin cells are hydrophilic, they're water-loving, they attract water. The skin cells absorb the water, causing the cells to expand and bloat and swell until eventually the membranes burst. Hence why sodium bicarbonate drops, in my experience, works better with Keratosis obturans. The negatives of sodium bicarbonate drops are that it's water-based, and water sometimes, I'm not a big fan of it in the ear. It can macerate the skin, it can cause dryness, irritation. Also, although sodium bicarbonate drops it's regarded to be antiseptic, but there's always a risk of developing an infection with water in the ear. And it's also alkaline. Our ears are naturally acidic, so it changes the pH of your ear, increases the pH level, which can then sometimes lead to an infection. Not always, but there's a risk. But it definitely works better with Keratosis obturans. Surgery can sometimes be performed, so an ENT surgeon can remodel the ear. We can put fatty grafts in the widenings to narrow the ear canal in some respect, or patch up these kind of erosions and widenings. With Keratosis obturans, the widening is typically quite global though, so it's all the way around the perimeter of the ear canal. Other treatments, especially pre-removal, because Keratosis obturans can be extremely painful. So sometimes it has to be done under local or general anaesthetic. I've only had one case where it's a young girl, came from Liverpool with her parents. The first time I managed to remove it, they're obviously seen several specialists local to them. On the second occasion, it just wasn't possible. I referred them to an ENT colleague of mine who used some local anaesthetic, but even then it was just too painful, and they had to undergo surgery. Steroid drops, anti-inflammatory, has anti-inflammatory effects. Because with Keratosis obturans, if it does start to really compress against the canal walls, you can get inflammation, swelling. So dexamethasone, I know, sometimes prescribe so steroid drops to help reduce inflammation, which can then help to remove the plug of dead skin. Keratosis obturans can be difficult sometimes for people to diagnose because it just has a very similar appearance to earwax. It's only when you touch it, as soon as I went in that ear, straight away, you just know it's Keratosis obturans. You just get this keen aesthetic feel. So there's a bit of dead skin around the edge. I'm not too concerned by that. This ear was fine. There's no Keratosis obturans in there. The eardrum was retracted. They have a type C tympanogram, which means negative middle ear pressure. So it recommended some nasal decongestions and the O2 vent nasal balloon. That's all the dead skin that I removed from the patient's right ear and also left ear. I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.